The mission of Center for Health Disparities, Innovation and Studies, known as CDIS at Eastern Michigan University, is to promote the health and well-being of underserved populations with priority focus of Asian Americans.
CDIS is one of 36 recipients of the 5-year CDC REACH initiative to reduce health disparities among racial ethnic populations in the U.S. with the highest burden of chronic diseases. After controlling for age and body weight, Asian Americans still experience higher prevalence of diabetes compared to non-Hispanic whites. The landmark CDC Diabetes Prevention Program, DPP, can prevent or delay the onset of type 2 diabetes. However, it is primarily utilized by English-speaking participants. Here in CDIS, we recognize the challenge and are aware it is extremely crucial to increase DPP access for Asian Americans. In the process, we strengthen the workforce of bilingual DPP coaches and work with Beaumont Health System to expand their DPP offering to Chinese population. Here is our journey.
Beaumont Community Health started to offer the National Diabetes Prevention Program in 2017. We were doing a really good job at achieving the national benchmarks, really supporting patients and reducing their risk of type 2 diabetes. However, after offering the program for a little bit, we started to see that there was a certain group that we weren't really servicing. We are so grateful for our partnership with the Association for Chinese Americans, EMU, and the REACH grant in order to offer the diabetes prevention program in Chinese. It really allowed us to look at the program with a deeper health equity lens and supporting patients live healthier lives in the context of their own cultures. The grant made this possible.
A unique referral process for Community Clinical Linkage CCL was instituted where Association of Chinese Americans, a CDIS community partner, identify potential participants during their health screening and refer them to Beaumont's DPP. This works well for individuals who do not have primary doctors.
We really enjoy teaching the DPP classes. Our participants are very passionate and hardworking. Sometimes they even try to find the resources outside of the classes by themselves.
Research shows DPP can cut the risk of developing type 2 diabetes by 58%. Two contributors to this outcome are 5 to 7% of body weight loss through healthier diet and 150 minutes of physical activities a week.
Upon completion of the first Chinese DPP, 57% of participants achieved at least a 5% body weight loss benchmark, and the average activity time was 245 minutes per week. After 12 months, the session notably retained 93% of participants enrolled in the program.
那我的这个运动方式呢，就是平常天气好的时候，我会去走路，或者呢，我会去做椭圆机，或者做一些哑铃，或者是做一些瑜伽的运动、垫上的运动。
我注重饮食方面呢，我是在少盐、少糖、少油，特别我做那个豆豉蒜蓉的那排骨这个真是好的。
所以我每天坚持，课堂要求是我们一周要健身要走路啊，活动什么150分钟，实际上我都double，我每次都是300分钟。
这一次呢，通过老师讲呢，我就知道了，在不好的条件下，外边不能出去的情况下，也应该锻炼，就在屋里找些适当自己的运动。所以我真的这班的学习我是真是受益呀，感谢。
Now you can see why it is so important to replicate the success of Chinese DPP to other limited English proficiency groups. With the support of Michigan Department of Health and Human Services Diabetes and Kidney Unit, we now have 16 bilingual coaches who can conduct DPP in Burmese, Bangladesh, Chinese, Nepali, Tagalog, Thai, and Vietnamese. We hope we can count on you to collaborate with us on this very important work.
欢迎参加。